Hello, my name is Breslin Hamble, and I'm a current Sports Med 3 student. My project is on ACL autograft rehab. What is the ACL? The anterior cruciate ligament, also known as the ACL, is a critical ligament in the knee that plays a vital role in stabilizing the knee joint. It prevents the shin bone, also known as the tibia, from sliding too far forward relative to the thigh bone, which is also known as the femur. Knee stability. The ACL is essential for maintaining knee stability, particularly during sudden change in direction and rotational movements. Anterior displacement prevention. Its primary function is to prevent exercise anterior translation of the tibia onto the femur. This is crucial for activities requiring pivot. Common sports injuries that we see in ACL tears are soccer, basketball, skiing, football, that are often due from non-contact and twisting or hyperextension. What are the differences in ACL surgery? An ACL autograft is a surgical procedure where the patient's own tissue is used to reconstruct a torn ACL. This approach has several advantages, including excellent tissue integration, reduced risk of disease and transmission. An ACL allograft uses a tendon from a cadaver to fix a torn ACL, so the surgeon doesn't have to take from your own tissue. It can take a bit longer to heal and has a small chance of the body to reject it. What is an ACL autograft? The ACL autograft is a stronger option of the two surgeries due to the usage of the own tissues that come either from your patella tendon or your hamstring tendon, due to the patient or doctor's preference. Why rehab matters. Post-surgical rehabilitation is essential for a successful ACL autograft recovery. It helps the graft heal correctly, restores full knee function, and gets athletes safely back to the sports that they love. A complete rehab program prepares the athlete both physically and mentally to return safely to their sport. On the right side of your screen, you can see different rehab goals. Our first goal is graft protection. Careful rehab protects a new graft from stress while it's healing. Our second rehab goal is motion restoration. Gradual exercises help the knee regain its full range of motion and prevents stiffness. Our third range of motion goal is to strengthen and rebuild, focused on exercises to strengthen the quadriceps, hamstrings, and glutes. And finally, our last goal is balance and control. This helps with balance and proprioception training to improve coordination and prevent re-injury. Rehab timeline. Phase 1, motion and protection. Weeks 0 through 4, we focus on reducing swelling and getting full knee extension and gentle bending with pain-free limits. Phase 2, early strengthening, weeks 4 through 6. We start with light resistant exercises to rebuild muscle and strength around the knee. Phase 3, we strengthen and balance. Weeks 6 through 12, progress to harder strengthening exercises and single leg balance training. Phase 4 includes jogging and advanced strength training. Weeks 12 through 16, gradually returning to impact activities like jogging while increasing strength and agility drills. And finally, Phase 5, sport training, weeks 16 through 20, performing sport-specific drills, cutting, pivoting, and high-intensity activities to prepare for full return. Post-operative goals, weeks 0 through 2. We want to reduce swelling and protect the graft. Our primary focus is on minimizing inflammation and ensuring that the surgical site is protected from undue stress. We want to keep the brace locked in full extension to protect the new graft and prevent an unwanted flexion. And we want non-weight-bearing exercises to prevent stress on the healing graft. We will also want to ice and elevate to prevent swelling and pain. And finally, we want to do quad sets and ankle pumps to prevent atrophy. Motion goals, 0 to 4 weeks. Hitting range of motion goals in the first month is crucial to prevent stiffness and ensure the knee works long term. Early focus is regaining full extension because it's much harder to restore later. Week 1 flexion. We want to aim for at least 90 degrees of knee flexion by the end of the first week. In week 4, we target for 120 degrees of knee flexion by the conclusion of the 4th week because we want full range of motion. Our next range of motion goal is to regain full extension early. If we do this early, it'll be easier in the long run, and if we do it later, it'll be harder. Phase 1 of rehab, weeks 2 through 4. As swelling goes down and healing progresses, the focus moves to slowly increase knee movement and start by controlling weight-bearing exercises. This phase is key for regaining normal knee function. Some key exercises and activities are gradual weight-bearing walks with crutches and slowly increasing the weight on the operated leg. Heel slides, gently bend the knee, gradually regain flexion. straight leg raises to strengthen quads and hip muscles without stress on the knee, and light stationary bike and low resistance cycling to improve the motion and fitness. Phase 2 of rehab, weeks 4 through 6. Key exercises and activities. Stronger walking and proprioception. Walking independently focuses on normal gait and practice balance exercises. Bridges and glute activation strengthen glutes and hamstrings for better knee stability. Light leg press uses controlled resistance to gradually strengthen the quadriceps and hamstrings. Step-ups improve functional strength and prepare for single leg activities. And beginning pool therapy helps with low impact on aquatic exercises through strength, motion, and gait training. Our goal is to build strength safely while maintaining the range of motion gained in Phase 1. Phase 3, weeks 6 through 12. Key exercises and activities. Lunges. Forward and lateral lunges for dynamic strength and stability. Single leg balance. Advanced balance exercises, often on unstable surfaces, help improve coordination and proprioception. Leg press progression increases resistance and variations to further strengthen the lower body. Elliptical training helps with low-impact cardio to condition the knee safely. And progressive strengthening continues to increase the intensity and complexity of all exercises to get ready to return to sport. Our goal is to build advanced strength, improve balance, and prepare the knee for sport-specific movements. Phase 4, weeks 12 through 16. Key exercises and activities. Gradual jogging. Begin light controlled jogging to reintroduce impact safely. Advanced strength training. Continue to progress leg press, lunges, squats, and core exercises. Agility drills. Introduce cutting, pivoting, and lateral movements with low intensity. And finally, plyometrics. Gentle jumping, hopping exercises to prepare for sport-specific movements. And finally, safely reintroduce impact activities in advanced strength and agility coordination. And finally, sport-specific and sport training, weeks 16 through 20 plus. Key exercises and activities. Cutting and pivoting drills. Practice sharp directional changes safely. High-intensity agility footwork. Incorporate sprints, ladders, and cone drills. Sport-specific drills stimulate movements and skills required for the athlete's sport. And psychological readiness. Build confidence and mental preparedness for full return. Thank you for listening to my presentation.